genital organs and perineum. External female genital organs consist of labia pudendi majora, here and here, at this diagram, this one and this. And space between them, that is pudendal cleft, rima pudendi, this space. Then labia pudendi minora, lesser lips, here and here. And space between them, that is what? Vestibulum vagina. And what opens into the vestibule? Here it is ostium urethra externum. This is ostium vagina. And duct of Bartholin gland, that is glandula vestibularis major, Bartholin gland. It also opens into the vestibule, near of ostium vagina. Then, here it is clitor, that is glans clitoridis. Clitor consists of two cavernous bodies. If you remember, in male, penis consists of two cavernous bodies and what?
One spongious.
And one spongious. Here it is, clitor consists of only of cavernous bodies, corpus cavernosum. And corpus cavernosum makes glans penis, or glans clitoridis, body of clitor. And crura clitoridis, the same like crura penis, attached to ramus inferior ossis pubis. And in male we have unpaired spongy body, corpus spongiosum. In female we have bulbus vestibuli, this bulb that is venous plexus, which is at the inside of labia pudendi minora, and bulbus vestibuli, it is paired, right and left bulbus vestibuli, and they join together with the help of isthmus, which is in space between glans clitoridis and ostium urethra externum. Here, right and left bulbus vestibuli join together. What else? Labia pudendi minora, near of glans clitoridis, subdivides into two crus, medial and lateral. And here it is the same, medial and lateral. Two medial crus join together below of glans clitoridis and makes frenulum clitoridis. And two lateral crus, this and this, the same, surround clitor, glans clitoridis, and makes prepuce, preputium clitoridis. Bartholin gland, that is glandula vestibularis major, it is mucous gland, and it opens into the vestibule. The same in vestibule opens small glands, glandula vestibularis minor, but here impossible to see them. They are small mucous glands which also opens into the vestibule of vagina. Now, perineum, that is complex of structures which closed outlet from true pelvis. And perineum subdivides into urogenital diaphragm and pelvic diaphragm, and border between them, that is transverse line which join together what? Tuber ischiaticum on the right and on the left side. In new classification, it is absent in your textbook. Urogenital diaphragm, today we speak about urogenital region, regio urogenitalis. And in pelvic diaphragm, we speak about regio analis, anal region. But you will answer like in your textbook. In urogenital diaphragm, we have deep and superficial muscles. Deep muscle, that is deep transverse perineal muscle, musculus transversus perinei profundus. And if you remember, in place where female urethra pass through this muscle, it makes external sphincter of urethra, musculus sphincter urethra externum. This muscle is also deep muscle of perineum, two deep muscles, deep transverse and musculus sphincter urethra externum. And three superficial muscles. This is superficial transverse perineal muscle, musculus transversus perinei superficialis. This is musculus bulbus spongiosus, and this one is musculus ischiocavernosus. They are superficial muscles of perineum. And in urogenital region, you should know three fascia. One fascia is above, it is above of urogenital diaphragm, above of this deep transverse muscle. This is superior fascia of urogenital diaphragm. Next fascia between deep and superficial muscles, this one, that is inferior fascia of urogenital diaphragm. And superficial muscles supplied by fasciae Pyrenei superficialis, superficial fascia of perineum. Now, pelvic diaphragm. Pelvic diaphragm also has deep and superficial muscles. Deep are musculus levator ani and coccygeus muscle. Levator ani and musculus coccygeus, they are deep muscles. And superficial, this sphincter, musculus sphincter ani externus. We also has internal sphincter, but internal is involuntary sphincter because it consists of smooth muscles. It is part of anal canal. And superficial muscle, that is part of perineum, and it consists of striated muscles. And in pelvic diaphragm, you need to know two fascia. One fascia above of levator ani, that is superior fascia of pelvic diaphragm, and here it is inferior fascia of pelvic diaphragm, fascia diaphragmatis pelvis inferior. And in pelvic diaphragm, we can see fossa, that is fossa ischioanalis. In your textbook, it is fossa ischiorectalis. It is better to call it fossa ischioanalis. If you will answer fossa ischiorectalis, I not decrease your mark, but better to call it fossa ischioanalis. And this fossa has four walls. Anterior wall, that is superficial and deep transverse perineal muscles. Musculus transversus perineus superficialis and profundus, they are on anterior wall. Posteriorly, here it is musculus coccygeus and musculus gluteus maximus. Medially, that is levator ani and sphincter ani externus, and laterally, that is tuber ischiadicum and musculus obturatorius internus, the same on the lateral side. And fat tissue, here it is present, and name of this fat is paraproctus, and inflammation of it paraproctitis. Well, that is all about external female genital organs and perineum. Your questions?